Have you ever felt trapped in a room with the walls closing in and you feel like there's no escape with the room getting hot and getting smaller and smaller as time ticks on? About 15 years ago, I was in Tennessee at a location called Ruby Falls. Ruby Falls is an underground cave. You have to take an elevator to get to the bottom. Throughout the walk of the cave, and the deeper that you got, it feels like the ceiling is getting closer and closer to your head, and it seems like the walls are getting narrower and narrower. The more you walk throughout the cave, the hotter and hotter it got. Throughout the walk of the cave, it felt like it was getting hotter and hotter, and the walls were closing in. It felt like there was really no way an escape out. And you weren't allowed to go back to the beginning and back up to the main level until you saw a waterfall at the end. But people started to freak out and started trying to run back. And I turned to my mom and I said, why are people freaking out? And she said, well, they're claustrophobic. And I used to think that this wasn't a real thing until firsthand I saw that it was. People who suffer from claustrophobia may frequently make an extra effort to avoid enclosed environments like tubes, tunnels, elevators, trains, and possibly even public restrooms. However, avoiding them could make phobias worse. And when in a small space, some claustrophobics suffer very little bit of discomfort, and others could experience extreme discomfort. And that can lead to panic attacks or people losing control of what they say and do. About 12.5% of the population have this fear, with the majority of them being females. I'll be going over and talking about what the effects of claustrophobia are and how that can affect someone. How claustrophobia is diagnosed. You're substantially less able to lead a normal life if you have phobias. Your healthcare professional may give you a questionnaire to complete or speak with you directly to learn about how your claustrophobia has affected your daily life, how frequently it happens to you, what your fear is, and how it could impact like friends and family in your everyday life. And then your doctor might also ask you questions about what stressors or any types of medication that you could possibly be on, and try to identify if you really truly are a claustrophobic. Another way your doctor might be able to identify if you are claustrophobic is your intense phobia of enclosed environment has been prevalent for like at least 6 months. Your worry or fear is related to a particular circumstance or thing, in this case confined places like an elevator or maybe a smaller vehicle. Your specific dread, or when you consider the feared event, usually trigger your fear and anxiety, or you either avoid or deal with your feared scenario with great worry or anxiety. Sorry. And your fear is excessive compared to the actual threat. And lastly, you experience severe distress from your fear, and it's constantly getting in the way of everyday life. What is claustrophobia? Claustrophobia is an anxiety condition that makes people extremely afraid of small places and small spaces. You may have claustrophobia if you have extreme anxiety or distress when you're in a small space, such as an elevator or a crowded area. When these types of people are in small spaces, some people have symptoms of claustrophobia. Others really only become aware of this situation when they are getting an MRI scan at the doctor's or hospital. Everyone experiences claustrophobia differently, from a slight feeling of unease to a full-blown panic attack. Anxiety can vary, can vary greatly. Doctors must determine that your anxiety is, in fact, severe enough to be able to classify it as a phobia. Claustrophobia is a fear of enclosed spaces. As I said earlier, about 12.5% of the population have this fear, with the majority of them being women. How can you deal with claustrophobia? The best way to treat and overcome claustrophobia is to progressively expose yourself to the circumstance that makes you anxious. Desensitization or self-exposure therapy is a term used for this. You could either do this on your own, or you could do it with self-help, or you could get a professional's assistance. Systematic desensitization is a technique that teaches a patient how to manage her reaction to what she fears. And it is known as one of the best phobia therapies. The therapist is going to first teach you how to physically unwind. Then she or she will ask you for a ranking of what your fear is on a hierarchy. For instance, you might feel at ease in a car, but not so much in an airplane, or not at all on a train. The therapist will introduce you the trigger, and then when they see that it triggers you, they're going to teach you a way to have a response to calm down, maybe a deep breath or something of that matter. Claustrophobia is a fear of tight spaces. If the fear starts to affect your everyday life, then it might be time to reach out to a professional or a doctor, or even possibly a therapist, to try and overcome this phobia. Remember, as NHS stated, the best way to overcome a terrible fear of claustrophobia is to use desensitization. With dedication and the right resources, you can overcome the fear of being claustrophobic.